I'm an obstetrician gynecologist. In Victoria, we don't do any primary care obstetrics, which means that my office sees mostly gynecology patients, and all of our obstetrics patients are seen through the hospital setting when we are on call. Decided to look for an EMR. Everyone had told me to look for the PITO supported ones, and at that time there were only 4. So I had access to those, and I called the reps and had a few sessions with them, and I found that they weren't geared towards a specialist. I found them clunky and they were just geared towards more of a GP office. One of my colleagues here in the city was using Accuro and had had really great success with it, and so I contacted Optimed, and they came out to my home and gave me a in-person training session, and from immediately after that I saw that they were very much specialist driven, and knew that that was the one I would go for. It was just so much easier than the others. The main reason I wanted to use Accuro was because I wanted to be able to access my charts anywhere without having to drag a massive suitcase of charts with me like I've seen some of my colleagues do. And so I wanted a system that I could access through the internet, and so Accuro was able to give me that. So it's been fabulous. So I can access it here in my office on my portable, I can access it at home, and I can access it at the hospital when I'm in the operating room or when I'm on call and I need to pull up a patient's chart immediately because lab results have come in, or if I'm in the OR and I need to see their histories. So that's been a definite plus, is the ability to access it anywhere.
The most common patient that I see is for GI endoscopy, so for colonoscopies and gastroscopies, and of course I do many different types of surgery as well. The little time that I did spend in the offices, I got a sense of how different offices run, and it was my impression that the offices that had an EMR were more efficient than the ones that were on the traditional paper type system. Because I do most of my work at the hospital, it's very important to me to have access to all of the records, and for billing purposes as well, not only at the hospital but in other settings, or even at home. You know, I could do telephone follow-ups, for example, from anywhere. I could do it on my cell phone, you know, looking at stuff on my iPhone. And so it gives a lot more flexibility to my schedule to be able to do that. The reason I chose Optimed's product was essentially 2 features, and those are the Repiform feature and the template feature. I think those 2 are probably what set the Optimed program aside from the others. And it's also more specialist oriented and customizable, so you have the opportunity to use these tools in unique ways, and you know, I'm always coming up with new ways to use them actually, but that was what set aside Accuro from the other vendors.